Despite the U.S. seeing its fourth warmest year on record, it was another cold day for Chicagoans as temperatures felt as cold as 2 degrees below zero. Meanwhile, leaders are working to address the needs of Chicago's homeless population, both on an emergency basis and with long-term solutions. Joining us to discuss the current state of homelessness and her work is Neely Vasquez-Rowland, co-founder and president of A Safe Haven Foundation. It's a local nonprofit addressing homelessness. Nellie, thank you so much for joining us. What kind of demand are you currently seeing for your organization's services? I would imagine it's certainly increased since the impact of the pandemic.
Well, Brandis, we've been on the front lines of helping the homeless for the last 27 years, and this is the worst we've ever seen it. We are getting inundated with calls, emails, and walk-ins from people that never imagined that they would ever need help like this before.
And your organization, last year you also opened a COVID-19 medical respite center for individuals experiencing homeless. How has that been impacted, especially during this Omicron surge?
The medical respite, the COVID-19 medical respite, we actually opened in April of 2020. In response and out of serious concern for the homeless and people that were living in doubled up situations, seeing what was happening around the world with hospitals being overwhelmed. We were seriously concerned that the homeless were going to be at the bottom of the list in terms of being offered help in a hospital bed. So thankfully, we were able to partner with Rush to come in and bring a healthcare team. And they work side by side with our behavioral healthcare team and all of our wraparound services to help really address and meet the needs of people that are homeless and also COVID positive. Thankfully, we've had over 1,000 people come through our programs, and today the vast majority of them are working on the rest of their plans to get their lives back on track because we were able to really assess their social determinants of health. And that's our goal with everyone that we serve, and that is truly trying to help them get their lives back on track.
And how would you say COVID continues to drive or impact homelessness in Chicago?
It's having a serious impact. Before COVID-19, there were about 40% of the population was already living paycheck to paycheck. And those especially that were working in, vulnerable types of jobs where, they lost their jobs or couldn't get back to work for one reason or another, their children were home. Those people that although the rent moratoriums did help, that did not keep them from falling behind on many of their other expenses. So we are still seeing people that benefited from the moratorium, facing homelessness right now and getting evicted. So there's a lot of reasons why the pandemic is affecting homelessness. Also, we're seeing a surge in the opiate epidemic and mental health issues. People are relapsing. And these are things that are really lost in the shadows, of the pandemic, but are very, very real problems that people are facing that we are seeing on the front lines.
Of course, we've been experiencing some very frigid temps over the last week or so. It's supposed to mellow out a bit this week. But do you have concerns about experiencing a shortage of emergency beds as winter continues?
I have major concerns. Prior to the pandemic, the city of Chicago, for example, had 3,304 beds to be exact. Today, they say they have about 3,000 beds. So that's about a 10% decrease in the number of beds that were available in the first place. And even before the pandemic, according to the 2020 census, our point in time count that was done in January of 2020, it reflected that we at that point in time had 5,800 homeless, unsheltered homeless. And that doesn't include the sheltered homeless or people that are living in doubled up situations, which are over 100,000 people. So as you can imagine, there's a huge gap in the number of beds that are available and the number of beds that were cut because of the pandemic and the need to meet the social distancing requirements that CDC required, and the fact that we have not replaced those beds. It's a perfect storm. We have a rise in demand for beds. We have an opiate epidemic where many of these homeless organizations are facing major outbreaks within their homeless organizations. And even if they had another bed, they're not accepting new intakes because of the COVID-19 outbreaks that they're having within their homeless organizations. So there's a lot of problems that are happening right now. I'm so glad we're having this conversation because I do want people to know that we do need help. and
Well, and
if
to
they're
that point, Nellie, because it sounds like, you've got one problem compounded by another. We've got about 45 seconds left. But when it comes to, creating these longer term solutions, what more do you think needs to be done? Where do you think the city, policymakers, nonprofits and philanthropies, where do they need to step up?
Well, I think that for the first time in history, we actually have a once in a lifetime opportunity because of all the federal funds that have hit our state, our county, our city. We have an opportunity to really think differently and really think about what are the best practices. Where is there an infrastructure that we can actually look at and say, here's a way we can address the human infrastructure by providing behavioral healthcare services, economic development opportunities, and permanent housing opportunities. That housing has to be a continuum. It has to include transitional housing. No doubt about it. This is where people get the type of help that they need from behavioral healthcare specialists, and all kinds of services, educational services, job training services, so that they can move into their own apartment in a way or home that is going to be sustainable. So this is a time where we need to think differently. We need to think short term and long term in terms of how can we create an ecosystem that is designed to be vertically integrated to solve and heal the root causes so that people do get back to work
Sounds like
and
an
do get their lives
opportunity,
back.
absolutely, to take care of a problem long term. Nellie
Yes.
Vasquez Rowland, thank you so much for joining us. That's where we'll have to leave it.
Thank you so much.